Screen, okay, got the right one. All right, from the beginning. Okay, so I've long been interested in compassion-focused approaches. It's been in the literature. The CBTp literature is one of the third wave approaches that's often used with CBT. And so I've been over time reading about it, trying to integrate different approaches. And so part of this presentation was an effort to try to pull some of that reading and work together. And as I mentioned, I just did a 4-day training on it with one of the developers. And so trying to integrate that information. So my hope for this morning is to give you an overview of CFT, what it is, where it comes from, a little bit on some of the strategies, it's often referred to as compassionate mind training, and then a little bit on the approaches for voices, compassion-focused therapy for voices. And I will probably use, acronyms just to save a few words for me. So I'll talk about that a little bit, how it integrates with CBTP potentially, and then just a little bit on the outcomes that are available. All right, so most folks who are in this profession are very familiar with compassion. It's probably a characteristic that pulled us in this career field. And so let's start at least with the definition, and the way they define it in CFT is a sensitivity to the experience of suffering and a desire and commitment to try to relieve or prevent it. So there's two components, awareness and willingness, and then the action components. And the part of the action is willing to face it and then to do something about it. And so they make a big deal about it's not a feeling state or just feeling nice or kind. There's a lot more to it. The second piece that I really got from the training is that CFT is more of a process approach. And so the idea is by developing compassion, this facilitates conditions that support healing strategies. And so if you develop compassion, our bodies and brains have a lot of resilience built in. And if we can get into this space of compassion, our brains and bodies are able to heal. I don't want to say totally by themselves, but it kind of puts us in a position to be able to heal. So that's the second overview point. And then the third is, and I sort of mentioned this, it's a process approach intended to be integrated with other kinds of approaches. Because the framework is quite useful in that regard. So let me talk a little bit about the framework. As I mentioned, it's a evolutionary based model. And so one of the premises is that our brains were evolved in a way and organized in a way to perform key jobs, all right? And they talk about survival algorithms or patterns. And so the big three are protection and harm avoidance. So if there's danger, we have certain patterns that kick in automatically, heart rate, muscle activity, fight, flight stuff. Also, if we're in inescapable danger, we also have algorithms that kick in about demobilizing, shutting down, sort of this defeat submission state. And those are patterns that are developed very early on. A second survival pattern is goal attainment. So we needed to pursue food and shelter. We needed to do things, and we needed to have emotions and energy to keep us going to achieve those things in order to survive. And then the third emotion pattern system had to do with relationships, right? So in order to survive, we need to relate with each other, right? We need to get along. We need to seek partners, take care of offspring, form alliances, all those kinds of things. So our brain develops algorithms and kind of patterns for that. So the basic idea, by evolution, our brain evolves patterns to meet these social goals. One of the big underpinning components of CFT is the 3-circle emotion regulation systems way of thinking about things. And so one system is called the threat protect system, often in red. Its purpose is to detect that threat, as we talked about, and to keep us from harm. And so emotions that go with that are anxiety and anger, so vigilance. The sympathetic nervous system gets activated, amygdala is involved, adrenaline and cortisol, those are involved in stress as well. And so that's all to activate our bodies to do things. We have a drive emotion regulation system, or a drive system, and its purpose is to motivate. And it's so that goal attainment is reinforced with excitement, pride, some of those kinds of emotions. Those emotions get linked with seeking and acquiring, and the kind of neurotransmitters involved are dopamine and also sympathetic activation. So those are all kind of involved there. And then the third system is the soothing system. And the purpose here is to kind of heal, they often refer to rest and digest. So this is the part that lowers the stress. It's a system that's focused on bonding. It's when we feel safe and content when we're cared for. And the neurotransmitter oxytocin, which is very involved in pregnancy and childcare kinds of things, is involved there, and parasympathetic activation. So this is that rest and digest piece. And the idea is, well, a couple points. One is that our new brain competencies, I'll talk about in a minute, emerged from here. And the idea is that these systems were intended to work in some sort of balance. So there are times we need to be aware of danger and act accordingly. There are times we need to be driven to do things, and times we need to soothe. All right, so what happened over time is that we developed new brains. And so these three older brain systems, threat, protect, seek, acquire, and containment and safety, come in contact with our newer brain. The newer brain, which is really frontal lobe stuff, we developed the capacity to mentalize. This is a term used a lot in CFT. And it involves the capacities of the brain, like imagination, to envision things, planning, which is also part of that, mindful awareness, so we can reflect upon experiences, remember things, learn from things, plan for things. And all these abilities have enabled us to do great feats of technology, et cetera, et cetera. So this is a real gift for us. At the same time, the issue is for us as human beings is that our older brain and new brain interact a lot. And that's where it gets kind of tricky, because the older brain has a threat bias. So the overarching thing is be safe. All right. And so one of the things that's talked a lot about is better safe than sorry. All right. So because of that, we pay attention to when things go wrong, when bad things happen, because we're tuned into that stuff because it's important for survival. So when the two systems interact, our brain can create loops that we can get stuck in. And the way this looks is often worry and rumination. Let me give you an example of that. So this is Butters. This is our dog. And Butters is at all family events. And we had a recent family event where Butters, who is a part terrier, found some baby rabbits and dropped them in the middle of the party. Butters was just doing her instinctive thing, to which many of us were a bit horrified and scared. Of course, then Butters got very activated and kind of ran away a little bit. We handled the situation, and it all kind of settled down. You know, the company was okay. The dog was okay after that. What would happen is, part of the reason I tell this story is within 15 to 20 minutes, Butters was totally relaxed. So she got really activated and then just totally relaxed. For my daughter and I, who were in charge of Butters, who in our mind let this happen, we were ruminating about it. What happened? This was terrible. This is awful. We're bad. You know, so all this rumination, thinking about the past, projecting into the future, all that kind of stuff. So the pattern in the older brain, the original intended pattern was, okay, threat's there, threat's gone, relax. In the newer brain, the pattern is much more like we can keep it very active in our brain and cause a lot of difficulty. All right. So this is not our fault, but it is something that we can contend with. The other thing that grows out of these three systems are what they call social mentalities. And so the thing they often compare and contrast is the competitive social mentality with the cooperative and caring social mentality. So when I'm in compete mode, so if I'm playing against somebody in a sport, they're kind of the enemy. And so part of my brain turns off empathy and turns on the other things to be able to kind of compete if that's what's going on. Or if it's a war or whatever, you know, that competitive mentality shuts off part of the brain. In contrast, when we're working as a team to do something, or we're taking care of a child, a different mentality kicks in, a different social mentality. And those mentalities can affect how we see situations. So if somebody we see succeeds at something and they're our enemy or competitor, we might feel envy or anger about it. But if our child succeeds, we might feel some pride and excitement about that. And that's all determined by the social mentality that's in our mind at the time that we experience it. All right, when that, whatever that mode is that kicks in. All right, so we have these three systems. One of the things that's just intuitively makes a lot of sense is that these systems can get out of balance. So in life, there's conflict and suffering, which then leads to certain mentalities being turned on more of the time. So individuals with psychosis, schizophrenia, as you guys are all aware, have early histories that often involve trauma, physical sexual abuse, bullying, also have instances where they have fewer experiences of safeness and bonding some of the time. When that happens, the threat self-protect system gets really worked out a lot. And in the training, I talked about like that muscle gets really worked out. So that bicep is huge. Whereas the other muscles, the drive and excitement and soothing system, are not as online, sort of dominated by threat. And so we need to think about like, how do we rebalance the system? Now you'll see I have a note there, symptoms of strategies. And what they talked a lot about was rather than think about some of the experiences people have as symptoms, they could actually be strategies to handle this overdeveloped threat system that's turned on. So hold that, we'll come back to that in a bit. So what CFT tries to do is help rebalance the system. How do they do that? One part is normalizing explanations. This whole part about the brain's evolved in a tricky way. It's not our fault, but our responsibility. So kind of giving that understanding. And then the second part is we can use our built-in soothing system to reorganize how we face challenges. And that's compassionate mind training. What compassionate mind training is, this is not going to do full justice, but it includes practices that help people learn to turn on their soothing or compassion system, turn that mentality on in their brain. Some of the ways we do that is by helping individuals and ourselves develop an internal sense of safeness. And that can be accomplished by teaching people about body posture and voice tone, facial expression. All of those things in our body can communicate danger or safeness. They do practices that help people feel calm and safe. Grounding strategies, breathing strategies we know can help with parasympathetic activation. So we train folks to develop this internal sense of safeness. Mindfulness training is part of compassion mind training, helping people to learn how to turn towards experience without judgment, but more in a mindset of curiosity and just observing it. And then the third component of compassion mind training is helping people connect with three qualities of compassion. So they identify three things to really focus on: a person's internal sense of care and concern for others, strength and courage, and wisdom. All right. And so there are a lot of exercises, imagery, some embodiment that help you to think about what does caring look like? What does that feel like? When you're strong and courageous, what does that feel like? What does that look like? Wisdom, there's a part of all of us that has wisdom. What does that look like? What does that feel like? So kind of building that compassionate sense of self. Now, developing this internal safeness supports mentalization. Mentalization is the ability to think about one's own internal states and consider other mental states. So kind of your cognitive abilities. Kind of makes sense. When you feel really safe, you have room to be flexible in your thinking and look at things differently. And so they introduced this concept of multiple mind or multiple selves, sometimes referred to as doing parts work. So in other words, there's a part of ourselves that can embody certain states. So if I'm anxious, I can refer to the anxious part of myself. So if I got some news that I'm really worried about, my anxious self may kick in. And that involves certain thoughts, memories, body experiences, urges, motives, things like that. It kind of kicks into that mode, if you will. And so they communicate a language around, we can refer to parts of ourselves, if you will. And in CFT, they spend a lot of time talking about angry, anxious, and sad. You can use other descriptors, but those are the ones they focus on a bit more. And then, of course, there's discussion around the compassionate part of oneself that can be developed and sort of turned on. So once you have this idea of selves, you can map them out. How do they, in space, relate to one another? And this kind of overlaps with other kinds of therapies, by the way, but this is one of the things they do in their approach. So that when one can imagine this, they can relate to different parts of themselves. And the idea is, as you develop a compassionate self, that could be sort of the central part of you, if you will. This is sort of the wise center that can then respond to and relate to your anxious self or your angry self. You can kind of almost have conversations with those parts, or provide support and comfort in that kind of way. So then by extension, so this is the basic model, you could learn new ways to relate to your voices and psychosis from a place, that center of compassion, with understanding and with certain kinds of actions. So what would that look like? So they develop a compassionate understanding of voices in CFT as part of their formulation. So really kind of ask, what's the job or function of voices? What could be the job? And there are three big categories. One is protection from harm, not in what the voices say or do, sometimes though, but mainly in how the voices create a response in the person. So if the voices are activated, often people will be on guard and hyper vigilant. And so it's really that, could the function be that the voices are keeping you on guard all the time to protect you from harm, is kind of one of the rationales for it. Another function could be all the noise created by the voices is actually distracting you, keeping you away from difficult feelings or memories that are more painful, that may be too overwhelming to be in touch with, maybe dangerous, whatever the experience will be. That may be a function of the voice. Or the voice could work in kind of a PTSD way, where it's drawing attention to something that happened in the past that's not been resolved. And they talk about the brain having this tendency to want to get to resolution. And sometimes the repeated memory can be sort of an effort for the brain to bring it back into awareness with the idea of some sort of healing, but people are often very frightened by it and so push it away. So with that understanding, the CFT approach is then to help the individual reorient their relation to the voice, have some understanding about this, understand and kind of give oneself compassion for the difficulty that they're experiencing, but to change the relationship from this is bad, this is evil, I need to avoid, suppress, fight it. So that's more that judgment, defining and acting, to something of, I can be curious about this. What is this about? What led to it? More of an observing and exploring sort of relational pattern with the voice experience. So the idea is bringing the compassion system online to deal with the distress as opposed to the threat system, right? The threat system is the one that's always defaulting. Can we bring compassion to address the distress that's happening? And then deliver empathy, maybe for the unmet need or fear, or if the person, and again, often folks with voices will say, I don't want to have compassion for my voices. They don't want to start there for sure. But the idea of helping them develop just kind of a compassion and awareness, at least for themselves and their own parts of their experiences that they have. So that's a bit of the gist. How it integrates with CBT, I think there's a lot of natural overlaps. You know, they both have a common ground around building collaborative relationships, finding strengths, orienting to recovery, a lot of emphasis on normalization, education. The 3 circles models provides a way to do a threat-based formulation. And I don't have time to give an example, but they have those in the materials. And it's very consistent. I could see it fitting in the making sense formulation right under the underlying concerns box. You could build in there what's the function of the voice, have conversations around that. And then the compassion mind training can be used to support some of the CBT methods. Like I said, if a person is in a calm sort of focused state, they'd be much better able to do cognitive restructuring or maybe do a behavioral experiment. And actually, working with someone I've been working with recently, we kind of did a little test with this where we kind of did a little compassion, kind of got into that compassion mindset. And it turned out that he was a little bit better able to kind of draw upon some of the cognitive restructuring ideas we've worked on before. So that's kind of the intent, to kind of help them be able to do some of the things that we would like them to try. And then in compassion focused therapy, they have their own set of strategies like role plays, chair work, letter writing, et cetera, et cetera. So there's other things you can look into. So just to wrap it up, there's the data on the effectiveness of CFT. There's a lot more for group CFT than there is for individual CFT. They recommend at least 12 sessions to reduce clinical symptoms of a group form of compassion focused therapy. On the individual end, there's just a lack of randomized control trials to demonstrate effectiveness. There is a lot of evidence, pointing to individuals developing compassion, being able to do that, being able to kind of calm things down a bit, showing more positive emotions related to it, but it's not been tried in the same way that CBT has, comparing it with treatment as usual. Do we get effect sizes bigger? That kind of thing. And most of the work in CFT for psychosis is mainly case series with a few randomized control trials. So promising, but not quite there yet. The summary you can kind of read on your own. I think there's a lot of things about this model that can be integrated well, I think, with CBTP and some of the practice. So I encourage you to kind of look at the references, in particular, the final, once we send this out to you, there are resource links, general resource links for CFT, and then for psychosis, the 3 links at the bottom are very good. That'll take you to videos and various things that kind of show some of the CFT work that's available free, online, that kind of thing. So I'm going to stop there.